We have to learn how to conquer or mind our health. And so that is why I'm so passionate about it. And then just my work with young people, I found that scripture wasn't enough to deal with the stuff they were coming to me for. They were coming to me for stuff that I could give them scripture and then they would still struggle with that. So I wanted to be equipped and educated to be able to give them both. I do feel like our spirituality is a part of the equation, but it's not the only part of the equation. So I'm sorry if I offended any old school traditional people. I've been saying it for a long time. So I came from an old school church. So I know all the traditions, I know all of that. My dad was a bishop, so like I've been in this for a long time. But I've also learned that as we get knowledge, the scriptures even talk about mental health. It's in the scriptures. It's in the scriptures. If y'all want to know what happened to Nebuchadnezzar, he had a mental breakdown. Like, it's in the scriptures. All right. So I'm not giving you something that we have no basis for. All right. So Nikki, go to that first slide. I kind of did this looking at specifically women. I have a couple of things at the end that deal with being a minority because I feel like that's a part of the equation. That's a big part of the equation. But I want to talk about some of the gender differences that are there for us that's different from men when it comes to our mental health. Next slide. This picture right here is a graphic. So this graphic basically tells you the rates of mental health disorders in women and men. The first one, anxiety disorder. So the blue, the darker color, is women and the lighter color is men. And so you notice that for anxiety disorders, our percentage is higher. So 36% of women deal with anxiety disorders versus 25% of men. Panic disorders, again, we're double that of men. It's not a high percentage, it's 6%, but still we have a higher percentage than them. Phobias, so phobias are a lot of different things. It's more than just you have a phobia of spiders or you have a phobia of heights. Some people have phobias of social situations. So there's other ways that you can deal with phobias, and so we also have a higher percentage in that. For post-traumatic stress disorder, so PTSD is, for me, one of the most interesting things because it touches every demographic of people, regardless of your race, your gender, sexual orientation, if you're religious or not religious. PTSD touches everybody. It's what I chose to specialize in because in the church, we have a lot of traumatized people. As a culture, as Black people, we don't like to deal with stuff. So we have a lot of wounds that can't be seen, and because of the traumas we've experienced, we come to church with those wounds thinking that just being here is enough, and we don't realize that a lot of our behaviors and the things that we're doing are not directly related to sin per se, but it could be related to the experience that we have that has not been healed. Right. And so PTSD for us, we have higher occurrences of that, and there's a wide way you could get that, all right? It's not just you were violated or assaulted. We have what we consider mass traumas. So we know 9/11 was something that impacted the entire country. It impacted the world because it changed how we travel. It changed some of the procedures in other countries. So 9/11 was a trauma that impacted a mass of people at one time. You also have natural disasters. So we know in one year, it wasn't last year, maybe it was the year before, maybe it was last year, the stuff starts to run together, but we know we had multiple Category 5 hurricanes that occurred. We had one in Houston, we had one in Puerto Rico. That is something that can traumatize you, all right? And so we have to look beyond what we are kind of conditioned to believe a trauma is. It can be more than just someone has done something to you. It can be something, car accidents are trauma, all right? So things that are more practical or tangible or more common can be things that can put you in that place. Obsessive compulsive disorder, OCD, I kind of have a pet peeve with this because I feel like we label ourselves with OCD when we don't know what the criteria for OCD is, all right? I have students come to my class, so I also teach, I'm a college professor, so I also teach students. I teach a lot of intro psych sections, so they come into the class, it's a general ed, and they come and see me and they already in their mind think they know what something is. And as soon as we get to OCD, they're like, oh yes, I have that. My first question is, did you get a diagnosis? They're like, well, no, I just know I have it. Well, why do you think you have that? Well, this, and this. So then I pull up the DSM and I pull up the criteria And I was like, well, this is the criteria. You have to either have a obsession, a compulsion, or both, and this is the criteria to define what those are. Do you have this? No. Okay, then you do not have OCD. All right. I'm anal retentive by nature. All right. So I understand what that's. I'm the person that color codes stuff and labels stuff, and stuff has to be certain colors. Like it's bad. My husband gets frustrated. The cabinets have to be organized a particular way with the dishes. Like these dishes go here and these dishes go there. That's not OCD. I just like stuff the way I like it. All right. But we like to diagnose ourselves. I'm gonna get into that one too. The self-diagnosing. Just don't do that. All right. Major depression. We have higher occurrences of that than men. 20% versus 13%. A wide variety of reasons, and I'm going to get into that in a little bit. Impulse control disorders. So this is when you have a block that stops you from having the ability to stop yourself from doing things that you know you should not do, all right? Some people might have an impulse issue when it comes to their eating habits. Some of you guys are like, well, no, I just like food. No, maybe you have an impulse issue. It might be bigger than that. And I'm not trying to diagnose it to make it something, but sometimes it might be bigger than that. And then substance abuse disorders, this is the one where men, they win on this one. They go to substances, we usually go to food or restraining ourselves from food. That's usually where we go. But they have that one. All right, next slide.